Back home, South Africa's National Department of Health says that some of the recent protests by healthcare workers can be blamed on a lack of proper communication with its employees.
The department says some of the issues could have been resolved if they'd been escalated to the right levels. Its Deputy Director Anban Pillay was addressing guests at a national dialogue on the impact of protests on the delivery of healthcare services.
The National Department of Health admitted that its failure to comply with labour issues and obligations sparked protests by some health workers. But the department has blamed a lack of proper communication between itself and workers.
What has not happened, though, is effective dialogue between the employer and the employee to be able to achieve this. So, for example, where there's a dispute between employees and employer, matters are not escalated to the right level to actually effect that change. So we in the National Department could potentially resolve some of these matters if these were alerted to us early on in terms of trying to resolve these.
But trade union Denosa says it's knocked on government's door many times in an attempt to address issues. The union says if issues like a lack of resources, payments and worker safety are not addressed, it will lodge a formal complaint with the Human Rights Commission.
If they don't stop this, we'll have no option but to come to you to lodge a formal complaint and ask you to seriously consider now imposing a mandamus on the employer, because they have to. They have no obligation. This is not a nice or not. It is their responsibility as the government to provide health care.
The Commission says the public's right to access healthcare must be respected. However, it's also called on government to address challenges faced by healthcare workers.
The state has to start seeing the desperation in protests and potential for these to become sporadic and violent and have substantial economic and human rights consequences. Systematically, the state must put in place early warning systems that can identify the needs of its workers as they become more urgent and unbearable for the individual concerns, and then address them with a measure of care and diligence as envisaged by the Constitution.
The dialogue comes after a 2-month-long strike in the northwest and violent protests at the Charlotte Maxeke Hospital in Johannesburg. Mahlako Komane, SABC News, Johannesburg.